Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Hey, good morning and welcome to Ask the Doctor. I am Dr. Michael Lange and host of Ask the Doctor for, over 31 years. We're live via Salem Media in Tampa Bay, Florida. So it's actually good morning, good afternoon, and good evening, depending on what part of the country or what part of the world you're listening to. We're live via a boatload of radio stations throughout the country, live video streaming all over the world on social media. And now we have the sunshine out of our eyes. Amen. Anyway, like I said, I've been hosting Ask the Doctor since April of 1993. And this show is dedicated to you, the listener and the viewer. So no matter how simple or complicated your question is, as long as it's related to your vision, eye care, or a nutritionally related topic, pick up the phones and give us a call. And the reason I say give us a call, my very welcome guest, good friend, and ex-colleague and current colleague is Dr. Nathan Schramm, and we're going to introduce him in just a second. So it's not Dr. Hall, it's not Dr. Susan Somerton, it's Dr. Nathan Schramm. I'm going to give you the phone number. It's 1-877-969-8600. Remember, live call-in show, 1-877-969-8600. You can learn more at drmichaellange.com. drmichaellange.com also goes to all of our other websites. Or if you want to learn more about the nutritional supplements I've developed and researched that doctors are recommending all over the country, if not all over the world, that is fortify.com. So that's Fortifeye, fortify.com. I'm also going to give you the phone number twice to Fortify Vitamins. Charlene is at Fortify Vitamins Saturday morning now, answering the phone so you can order on Saturdays. Fortify Vitamins phone number is 866-503-9746. That's 866-503-9746. I personally hail from the Lange Eye Institute in the Villages, Florida. I can see patients on Tuesday, Wednesday, and Thursday, and some Fridays and some Mondays. And Dr. Susan Somerton is there 5 days a week, who also co-hosts the show with me. Of course, Dr. Lori Caputi and Dr. Richard Hall is there for free nutritional consultations. But with that, I am going to introduce Dr. Nathan Schramm. He is also an optometric physician, a certified nutritional specialist. He is, like I said, a good friend of mine. He actually worked at the Lange Eye Institute for about 3-4 years back in the day. And he is a guru in nutrition. He is one of the leading authorities in the country, if not the world, in scleral contact lens fitting and also in myopia control. And we're going to talk a lot more about that because we do all that at the Lange Eye Institute now. Dr. Schramm, welcome to Ask the Doctor once again, because you're no stranger. You've been a co-host and you've hosted the show by yourself years and years ago when I took a little vacation.
Thanks. Yeah, happy to be back. I worked for you for a good solid half a decade, about close to 15 years ago, 10, 15 years ago. Yeah. And it's great to be back. I'm living in Southern California now.
Time flies when you're having fun, doesn't it?
It sure
now,
does.
You're one of a select group of doctors in the world that has a specific fellowship training. What is that?
That's right. There's only about 300 in the world that are fellowship trained with scleral lenses. And a scleral lens is classified as a prosthetic. It's like a prosthetic cornea for people who have really severe corneal conditions like a scar or keratoconus. Keratoconus is where the cornea gets pointy and so not symmetrical and gets very thin. Patients can no longer wear glasses or see clearly with regular standard contact lenses. And the technology is life-changing, and that's why I got into this. We've had patients who are legally blind being able to drive again. It's just amazing.
Oh, it is amazing. We've been doing scleral lens fits at the Lange Eye Institute as well, but you take it to the next level. I mean, you have some amazing technology there in California. briefly just talk a little bit about that scleral lens fitting where you actually put a mold in the eye and customize these scleral lenses.
That's right. We got this FDA. It's FDA approved for. It's like a dental amalgam. Because we take this gel and it resembles like a miniature martini glass. You put the gel into the martini glass, put it to the eye. Within a minute or two, it actually takes the exact shape of the eye, and from that mold, we can make a lens within 3 microns of the shape of the actual eye. And that gives them the clearest, most comfortable vision possible.
And it's amazing. You have patients that will come in even post surgery, corneal transplants, and like you said, keratoconus, that can't see with glasses, can't wear soft contact lenses, and they've been told by their optometrist or their ophthalmologist that there's nothing else can be done, and they live with very subpar vision. And we fit them in a scleral lens, and bingo, some of these patients can get close to 20/20 vision, if not 20/20 vision, can't they?
Absolutely. And I've had patients who haven't been able to see clearly in 20 plus years. One story comes to mind that's pretty funny, where the husband looks over at his wife. I put the lenses on him. He looks over at his wife, and I thought that he was going to say something really sweet. And he goes, "Oh my gosh, you got old." and she, without missing a beat, she goes, "You better look in the mirror."
As 2 things you don't want to tell your wife, that she's old and fat. And my wife would never be old and fat.
I have patients crying in the exam room when they put this technology into their eyes. It's such a rewarding field, and I made it a goal of mine to train more doctors to do this. I actually started the first International Congress of scleral contact lenses, and it was the only Congress dedicated solely to that technology. And so we've been going strong for 7 years with that. I also do some international travels to teach the technology in India. My wife her family's from India, and I'm going to Armenia in September to do a medical mission there to train the ophthalmologists to learn how to do this technology, because there's a pretty high prevalence of keratoconus in the Middle East, and Armenia being like pretty close to Turkey and all.
And so for those of you that have keratoconus, if you had corneal transplants or have really bizarre corneas and you're not seeing well, certainly come to the Lange Eye Institute in the Villages, Florida. But if you're listening to us bright and early in the morning out in California, tell them where you're practicing at now, Dr. Schramm.
I'm in Costa Mesa, right next to the John Wayne Airport, and that's about an hour south of Los Angeles. I'm in lovely Orange County, California. And so if you got a private plane, we literally are a walking distance from the private side of the airport, or if you take in regular commercial, it's about a 10-minute via taxi / Uber.
There you go. Just a hop, skip, and a jump, and you can see Dr. Nathan Schramm in California. We do have a lot of listeners in California. Anyway, the phone lines are open. If you have a question, give us a call. Dr. Michael Lange and Dr. Nathan Schramm at 1-877-969-8600. We are live. This is this is like March 2nd, isn't it?
Yeah.
I think it is. March 1st, 2nd, 3rd, something like that. Saturday morning, 2024. Wow. Where has time gone? So give us a call at 1-877-969-8600. That's 1-877-969-8600. Also, we had a caller last week asking me about some grain-free cereal. Okay. What was a good grain-free cereal I recommended? And I mentioned a few, and I started saying Ezekiel. Ezekiel is not grain-free, but it is sprouted. It's a good cereal, but it's not gluten-free and it's not grain-free. However, I'm going to tell you a few of them here. So take your pencil, paper, write it down. One that I love, and this is what I had this morning, is called Lovebird cereal. It's gluten-free and grain-free. So Lovebird cereal. And then Purely Elizabeth is a pretty famous one. Purely Elizabeth is grain-free. All of them are. You have to get the one that's grain-free. So Purely Elizabeth. And then this morning we had some snacks on the way in. It's made by Simply Nature. Simply Nature is organic, and I like the keto coconut clusters. They're kind of like a snack, Nathan, but you can put some A2 cow's milk or goat's milk on it, and it'd be a cereal.
Yeah, I saw you eating that for breakfast this morning.
That's right. So for that caller, once again, if you want a grain-free cereal that's also gluten-free, either Lovebird, Purely Elizabeth, or Simply Nature. And Simply Nature, I think you can get at Costco and places like that.
Yeah, they sell it in the Costco's in California. I'm not sure if it's throughout the whole country.
You just got to join Costco. We're getting ready to take some phone calls here in just a second. We're going to talk a little bit about omega-3 fish oil today. I'm pretty famous for saying God made a pretty good body. As long as we give it the right fuel, it can perform at optimal levels, right? So the problem is the optimal fuel, oftentimes you can't buy over the counter, all right? Especially when it comes to omega-3 fish oil. The lion's share of omega-3 fish oil you buy over the counter is an ethyl ester molecule. That means it has ethanol attached to the backbone. That makes it very unstable, very inefficient. It takes a long time to absorb. It goes rancid very quickly. And you can test your fish oil to see if it's an ethyl ester molecule by squeezing the contents in a styrofoam cup. If it rots a hole through that cup in 10 minutes, even prescription fish oil, that's got ethanol in it. I think twice about consuming that. So when you look for omega-3 fish oil, make sure it says either TG form, triglyceride form, or RTG form. That stands for re-esterified triglyceride form. So what we do the ethyl ester form, but then we remove the ethanol and replace a triglyceride backbone. We have the best team in the world doing it in Norway. It's called EPAX. And we actually take mostly sardines near Antarctica, believe it or not. So these are non-predatory, very pure fish. And then we take the oils from that, and the Norwegians purify it to the level where there is no harmful contaminants, and also concentrate it to a level that is a therapeutic amount. So we have Fortify Super Omega and Fortify Super Omega 3 Max. And Dr. Schramm was actually involved in a pilot study we did years ago when we were launching Fortify Super Omega, proving that 2 per day brought the omega index between 9.2 and 11% in everybody in 2 weeks under 240 pounds. And what's the level we need to get our blood at, Dr. Schramm, for heart health benefits?
It needs to be above 8%. And all of our patients or subjects went 9% or more. Also, there's dry eye studies now showing above 8% has an effect on meibomian gland function, which we know that already. We've been promoting omega-3s for dry eye health for 15 plus years.
Right. And we're going to expand on that in a few minutes, but we're going to go to the phone calls first. Let's take the first caller. I think it's Sherry in High Springs. Sherry, good morning. Welcome to the program.
Good morning. I have a question about my peripheral vision. Due to a stroke, I lost my left peripheral vision in both eyes. Is there anything I can do?
Yeah, so that's called a left homogeneous field defect. That means you had a stroke to the right side of your visual cortex of the brain, basically responsible for that part of your vision. And I tell you, it's very, very, very rare that that vision will come back, okay? However, there are doctors, and we used to be one of the group of doctors, we just don't do it anymore. Dr. Dan Gottlieb in Stone Mountain, Georgia, I think he still does it. He invented something called a prism awareness system, where they actually use special prism that will allow you to see to that left side. So, and as you know, you have to adapt and overcome. You have to turn your head more than you would. Otherwise, you're going to bump into a wall. And
Yes.
if you're driving the car, you need to have an extra big outside rear view mirror. But this is common after people have strokes. And the good news, all right, if there's any good news about this, you still have half your vision, right?
Yes.
So you have to take a proactive stance, Sherry. And that's what Dr. Schramm and myself and Dr. Hall and Dr. Susan Somerton, we're all about, getting your body into optimal condition, optimal body weight, eating plenty of fruits and vegetables, taking things like omega-3 and certain supplements we take about, or eating a good fish so that your blood is not getting thick and clogging and throwing clots, and you got atherosclerotic plaque everywhere. So, strokes can be related to, elevated plaque along your linings of your arteries. It can be related to high blood pressure, and be related to a whole host of things. So you have to turn into a lean, mean fight machine so that you preserve the rest of your vision. Dr. Schramm, you see patients like this too. It's very rarely we see any visual improvement on these patients.
That's right. But we do have a thing called vision therapy. It's sort of like occupational therapy or physical therapy for your eyes. And the visual field won't come back, but we can make you more aware of the visual field that you do have. And actually, those two doctors in my clinic, Valerie Lam and Ariel Chen, both specialize in vision therapy. But that's all the way on the other side of the country.
Right. So you can find a visual therapist or an occupational therapist that is in tune with, vision post-stroke that can help you. And oftentimes you yourself just can adapt and overcome.
Okay. There's no special glasses or anything that'll help me?
Yeah, if you get a chance, you can Google Prism Awareness Systems. The Gottlieb, it's called Gottlieb Vision Awareness System. Gottlieb is Gottlieb, Gottlieb.
Okay.
So it's Gottlieb Vision Awareness System, and you can see who's actually fitting those in Florida or a short drive to Georgia. And I've had a lot of patients in the day when we used to do this. When I had the 14 locations, I specialized in things like that. But now I just have the Lange Eye Institute after I sold everything. So I just don't have enough time in the day to do everything I want. So we have to, farm that out. So look up Gottlieb Prism Systems, Gottlieb Visual Awareness System, and then consider occupational therapy or vision therapist that's in tune with this. All right?
Okay. Thank you.
All right, Sherry. Thanks for the call. Once again, you're listening to Ask the Doctor. It's Dr. Michael Lange and my very welcome guest and former co-host of Ask the Doctor, Dr. Nathan Schramm from California. So he's flown in to host the show with me. So give us a call, 1-877-969-8600. That's 1-877-969-8600. Talking a little bit more about omega-3 before we take the next call. Like I said, I always say if you only took one supplement, omega-3 is a good idea. There are definitive studies now proving that omega-3 in the right dosages is good for your whole health of your body. And we talked about this not too long ago. The latest study is in the Journal of Circulation. It was 2 million people over 30 years. And it talked about omega-3 helping. And it was also one that talked about increasing servings of fruits and vegetables. Just eating 3 more servings of fruits and vegetables a day actually reduced the chance of almost all forms of death. And there's a lot of other studies out there that we talked about recently promoting omega-3. Remember, omega-3 not only is good for lowering triglycerides and cholesterol, omega-3 can benefit glaucoma patients. It can support the optic nerve and help lower intraocular pressure, helps brain and cognitive abilities, okay? There's a study out there that shows it can reduce the chance of blindness from diabetic retinopathy by 45%. Also, Alzheimer's, it helps out, dementia, lowers blood pressure, helps with atherosclerosis, dry eye, as Dr. Schramm had mentioned. Also helps with recovery after any sporting event, and may, if your omega index is high in your body, may reduce the chance of a heart attack and a stroke. So it's not a miracle cure. It's not a treatment. It's, once again, God made a pretty good body if you give it the right fuel. So think of this as the right fuel, super high octane gasoline. And
there's also some studies being done on myopia. Myopia is when kids become nearsighted. They can only see up close and not far away. Having high levels of omega-3s in the system can be less likely that they get myopic or nearsighted.
So yet another reason, and we're going to be talking about myopia control here in a few minutes as well with Dr. Schramm, who's an expert in that arena. And so we developed Fortify Super Omega. Fortify Super Omega is 1,600 milligrams of RTG form in 2 gel caps. And then Fortify Super Omega 3 Max is 2,400 milligrams in 2 gel caps. Fortify Super Omega 3 Max is currently the most potent RTG form, Norwegian form omega-3 in the United States. Just had dinner with the Norwegians from EPAX. They flew in and took me to dinner a few weeks ago. And they said, Dr. Lange, you still have the most potent RTG form in 2 gel caps. All of our competitors, you got to take 3, and most of them, you got to take 4 to get to the level of Fortify Super Omega 3 Max. All right, we're going to go to the phones. We've got a lot of people loading up. Let's go to Steve in Clearwater. Steve, good morning. Welcome to the program.
Yeah, just to make clear, is what Dr. Schramm does, you're talking about the corneas and all. Do you do that same procedure at the Lange Eye Clinic, or does what he do unique?
We do scleral contact lens fitting at the Lange Eye Institute. He does take it to the next level, though. with these specific molds for very complicated patients. And that is something, we're considering getting into. We're in the process of bringing some new technology in. And Dr. Schramm was instrumental in me wanting to purchase this, that will even take our scleral fitting to the next level. What is that piece of equipment called?
The one that I was talking to you about last night does profilometry of the white part of the eye, and it's called SMAP by Visionary Optics. And basically, what we do is use a scanning laser to scan the white part of the eye in a couple different gazes, and then from that scanning laser, we can pick out a well-fit lens or design a lens within about 20 microns or so, 20 to 30 microns, and I'd say, actually, I know for a fact that 97% of my patients in my own practice, and I fit over 700 of these a year, 97% of them do fantastic with this particular technology. What we talked about earlier with doing an impression of the eye, really only 3% of my patients need that because of very large irregularities to their eye. Or if people that fly in to see me, they want the best of the best, or they want to be fit as quickly as possible, doing that impression of the eye will be the best way to go. Did that answer your question?
Yeah, pretty much. And one thing I think that would be fantastic if you and Dr. Schramm could get a relationship back with each other, and you could, sort of work together, and he could be part of the Lange Eye dynasty.
Keep talking. I'm trying to get him to move back to Florida.
Yeah, I know this is totally non-technical, but when the minute that he came on, I had a feeling that marriage born in heaven, and I think it would be fantastic if you guys had some kind of a business relationship, or he'd be part of your practice and you'd be part of his, and I think that'd be fantastic, even if he stayed in California.
Well, we could definitely co-manage, and we can refer patients back and forth. That's true. It's just a hop, skip, and a jump on an airplane.
All right.
Thank you, Steve.
One more question. The cornea is the only human tissue that does not vascularize. Well, it can, but it normally does not. How does it get its nutrients? And then I'll just listen on the line.
The cornea gets its nutrients. It gets its oxygen from the air. So that's why we ask patients not to sleep in their soft contact lenses, nor can they sleep in their scleral lenses, because that's where it's getting its oxygen. But there is these things called limbal stem cells that are on the edge of the cornea, and the limbal stem cells provide the nutrients and allow the cornea to regenerate every day. And one of the reasons we fit these scleral lenses is because of a person that their the edge of the cornea is no longer healing and recreating new corneal tissue. And usually you get vascularization of the cornea because of limbal stem cell deficiency. We can actually treat that problem by wearing a scleral lens, because the scleral lens keeps the eye in a bath of fluid the entire day. And we put into the scleral lens usually a solution called neutrophil is the primary one that I use, where it has electrolytes in there that are balanced to the actual tear composition. So it has like magnesium, potassium, calcium, and with the cornea being constantly bathed in that solution, it can actually heal the limbal stem cell deficiency. And that's one of the major parts of my practice, is not just keratoconus, which is the pointy cornea, but having other irregularities to the cornea, scars to the cornea, cornea not being able to regenerate. We have them wear a scleral lens to help that. Quite often with these scleral lenses, we can get our patients to the corneal scars to fade over time. It can take a year or two of them wearing the lens every day, but I've had patients their scars have faded 20, 30, 40% by wearing the lens. I've even had a few patients where they've worn the scleral lens for a while, and then the corneal scar faded enough that they no longer need to wear the scleral lens. There's also some research that we're doing at my over at Insight Vision in Costa Mesa, and it was started by Stephen Wilson, who's an MD at Cleveland Clinic. There's a blood pressure medicine, when put into a dilute form, it can fade corneal scars. It's still very much investigational, but the results have been pretty spectacular. So if you want to Google Stephen Wilson's work, it's really remarkable on what he's doing over at Cleveland Clinic.
Well, real quick, I know the cornea epithelial has a 7-day growth cycle. And I think it would be fantastic if they could find a way to accentuate the days where that's recycling. But I know it's a circumseptum rhythm, meaning a 7-day rhythm. And if you could put cytokines, like these guys are doing for regenerative medicine for bones and joints, if they could find out the cytokines which could amplify that 7-day growth cycle, so that instead of 2 days out of the week, it would be 4 or 5.
Well, that's sort of what that's sort of what our amniotic membranes do. And Dr. Lange puts quite a few amniotic membranes on his patients when they had a neurotrophic ulcer, or they've had even a scratch to their eye. So it speeds up the cytokine. It speeds up the epithelium healing. And one of the, like you said, it's a 7-day cycle. Often the cornea it can regenerate in a few days.
Right.
And like we've had patients who wake up with these things called recurrent corneal erosions. It's the top layer of the cornea gets peeled off, which is very painful. So when they wake up, it sticks to their eyelid, and they wake up and they're like in severe pain. But usually that pain goes away in a couple of hours, and that's another reason that we put scleral lenses on, is that can help heal the cornea, so they're less prone to getting these epithelial erosions and recurrent corneal erosions. We also do a combination of using doxycycline and steroid drops. I had a patient who had PRK about 6 years ago, and PRK is sometimes a treatment to help with recurrent corneal erosions. Unfortunately for her, it caused her recurrent corneal erosions, and almost every day she would wake up in extreme pain because her eyelid would stick to her cornea and would peel off the top layer of the cornea. We've had her in a scleral lens for 7 months now, and she has not had a single episode since then. Yeah.
Awesome.
So there are nerve endings in the cornea?
The cornea is one of the highest innervated parts of the body. And so it's the white part of the eye that has hardly any nerve endings. So the lens that I'm talking about sits on the white part of the eye. It doesn't touch the cornea.
Yep.
Well, thank you. That's very interesting. I had no idea that was true.
Thanks for the call, Steve. We got to get rolling here, buddy.
Okay.
All right. Take care. All right. We're listening to Ask the Doctor. We got a few more people on hold. We're going to get to everybody, I promise. Let's go to Daniel, and I don't know, it's Kenneth City, wherever that is. Good morning, Daniel.
Good morning, Dr. Lange. I got 2 questions, one on the scleral contacts, and the second one will be on my skin. On the scleral contacts, I've been a professional pilot for 40 years, and I was wondering if you or Dr. Schramm have used those on any professional pilots. I've currently been wearing progressive lenses for the last 4 or 5 years.
Yeah, I'll let Dr. Schramm address that, since he's really an expert in this whole arena.
Yeah, a huge part of my business is seeing pilots. We are literally next door to the airport, John Wayne Airport, and we see pilots all day, every day. Not all of them need these special scleral lenses. The ones that do are either they have keratoconus, because as a pilot, you have to be able to see at least 20/40. Most of them have keratoconus or have some sort of opacity to their cornea. But I do have a few patients that, like, I just want to see the best that I possibly can. We have professional athletes that wear these lenses, and baseball players. Most baseball players that are professional see 20/10, or they need to see 20/10. So if you have a normal cornea, it may not be necessary to wear a scleral lens. But if you have high levels of astigmatism, or if you have dry eye because your eye is in a bath of this saline all day, we're happy to fit you, and Dr. Lange can fit you too. That's a very straightforward case.
Oh, okay. That's great to know. And, my question, Dr. Lange, about the skin is, I'm 63 and I'm noticing my skin is getting thin, and I also have to turn a wrench on the aircraft occasionally. So is there any supplement, because I'm taking Nordic Naturals fish oil, besides that, for boosting the thickness of my skin?
Right. Absolutely. It's a great question. And 63, you're just getting started. You're a young man. Okay. But,
Absolutely.
at 63, a lot of things start to happen. Our muscles start to get a little weaker. Our skin starts to get saggy. It starts to thin, get wrinkly. And sarcopenia is the muscle wasting, and the skin goes hand in hand. And so interesting you bring that up. I'm holding in front of everybody right now on the video something called Rejuvenate. And this came out about 2 to 3 weeks ago now. We worked on it for 2 years. And what we've done, we've taken, we're one of the first in the country to use marine collagen tripeptides, not peptides. So they absorb much quicker. And the studies indicate that with 1 gram of this marine collagen tripeptide, only 1 gram, after 3 months, it minimizes wrinkles 10 times, fine lines and wrinkles, 6 to 8 times skin elasticity, and 4 to 6 times skin hydration. So it's amazing for the skin, the saggy, creepy skin that we get as we get older. But I wasn't satisfied with just the marine collagen tripeptide. So I used a Japanese rice ceramide that's backed by some great studies in the therapeutic dosage for the skin, hyaluronic acid for the skin and the joints, and then something called Dermaval. Dermaval is 9 superfoods that have been shown after 3 months to help rebuild collagen and elastin in our skin. And finally, we topped it off with an American-made Pure Whey liposomal vitamin C and some biotin and a few other vitamins. It tastes delicious, and I developed it because, let's quite frankly, I'm 62 now, and I'm starting to get some aches and pains in my body. The skin isn't what it was, and I'm looking for that fountain of youth. So we're working on that fountain of youth. This is not a miracle cure. It's not a treatment for anything. But once again, I go back to God made a pretty good body if we give it the right fuel. And I'd like to say this is one of the best fuels on the market for the skin and the joints. It's called Fortify Rejuvenate.
I tried it last night. It tastes good too.
Yeah, it tastes delicious. It comes in 3 flavors, and unflavored you can put in your coffee. All right, so I think we lost him there. But anyway, Fortify Rejuvenate, check it out. We're going to be doing a lot of TikTok and a lot of Facebook and Instagram parties, believe it or not, online with this very soon. I've got a company that's going to hopefully take it to the next level. So check it out, Fortify Rejuvenate, men or women. If you're looking for the latest in nutritional support, evidence-based nutritional support for the skin, hair, nails, and joints, it's called Fortify Rejuvenate. Go to fortify.com. That's FORTIFEYE, fortify.com, or call toll free 866-503-9746. That's 866-503-9746. All right, we're going back to the phones. I think John's been waiting patiently in Colorado. It's probably a little chilly out there. John, good morning. Welcome to the program.
Hey, good morning, Dr. Lange. Hey, sir. This is an interesting topic. I've been listening. I have a scar on my cornea, so I'm learning a lot from you. But the purpose of my call today is I have your Fortify Macular Defense zinc-free. Actually, I had an extra bottle of it, and I didn't know I had it. I just found it, and I'm looking. The expiration date is April 24th. So I'm wondering, I think it's okay to use the vitamins even if the expiration date is off for a little while?
Absolutely. I mean, now vitamin manufacturers can actually put the manufacturer's date on it instead of an expiration date. So the FTC protocol is after you bottle it, you got to stamp a 2-year on the label expiring it. It does not expire in April. Okay. I mean, let's put it this way. We have omega-3 that we've tested that expired 10 years ago, and it's still good. It's not rancid at all. And these are veggie caps. Okay. So as long as it's not stored in the trunk of your car, in a black car, in 150-degree weather in Florida, if it's inside your house, and you're in Colorado, so you're going to be fine. You're going to be fine. If you're not happy, you can always send it back, and we'll send you one that has later expiration date. We have a new batch that we're going to be manufacturing here soon, but you're going to be fine. You're going to be fine.
Oh no, I'm very happy with it. But just one more question on the storage part of it. In my opinion, and I may be wrong, I like to. I mean, you say storage is 59 to 86 degrees Fahrenheit. But I just like to keep, I consider all my vitamins of food, and I just like to keep them in the refrigerator. And my refrigerator's 40 degrees Fahrenheit on the top. And am I hurting the vitamins by doing that?
Not at all. As a matter of fact, they'll last a lot longer. And it's not a bad idea for people, especially after they open their protein powders or the Fortify Fit Pro, especially if you're not going to consume it all within a month, all right, to put it in the refrigerator, all right? And I also recommend everybody washing their hands very good before they dig in and grab that scoop of their protein powders, because, bacteria is on your hands and you put that back in there and it can contaminate it. So those powders work really great in the refrigerator. And if you're going to take your vitamins and you're not going to let them last a long time out on the shelf, it's probably not necessary. But if you want to err on the side of caution and make sure there's no bacteria or viruses growing in the bottle, then absolutely you can keep it in the refrigerator.
Okay, great. Thank you. I'll just make a comment. I don't know who it was I was listening to, but I love listening to a lot of YouTubes, health YouTubes, and of course that's why I listen to you. But there's one that definitely said that as far as the fish oils go, they definitely should be stored in the refrigerator once they're open. But that was their opinion, but I'm a firm believer in it.
Right. So, John, especially liquid fish oil. Any liquid fish oil, if you open it, I definitely recommend putting it in the refrigerator. Now, the way we put them in the gel caps, like I said, we have, I show patients how omega-3 looks when it's rancid. We keep a bottle from 2012, okay? And these things started to turn brown and go rancid in appearance just last year. And that's over 10 years. So if you have omega-3 fish oil, if you hold it up to the light and it's a yellow color and it's still clear and not cloudy, it's fine, all right? When it starts to turn brown, not yellow, and if it gets cloudy, it's rancid. And most of those in a gel cap, if it's done efficiently, can last, 5, 6, 7, 8 years without being in the refrigerator. But certainly the refrigerator will keep it even longer.
Well, that's wonderful. Hey, thanks for your time. And I love your products. I love your YouTube. And the only thing I need to get from you that I haven't gotten yet is that Rejuvenate. It sounds really exciting.
How old are you?
I'm 71. I'll be 72 this month.
Yeah, it's perfect. I mean, the Rejuvenate and also the Fit Pro that we developed recently. Remember, the Fit Pro is for the muscles, ligaments, and tendons, and the Rejuvenate is for the hair, skin, nails, and joints. So the combination of those two, you can mix them together, and we'll be 100 and still hiking up the mountain.
Great. Thanks again, Dr. Lange.
All right, John, you take care.
Bye.
All right, you're listening to Ask the Doctors. Dr. Nathan Schramm, my co-host this morning, a good friend, colleague from California, and of course me, Dr. Michael Lange. Give us a call if you have a question at 1-877-969-8600. That's 1-877-969-8600. Once again, we started talking a little bit about the omega-3. Check out our omega-3, and it's not the only reestified triglyceride form. That caller mentioned one that he's taking. It's a very good brand. It's a competitor. When you're looking at omega-3, make sure it says RTG form or TG form. If it doesn't say it, it's an ethyl ester form. That means it has ethanol attached. I do not recommend it. So omega-3 is very good for a condition called meibomian gland dysfunction and even blepharitis. And we're going to expand on that. A lot of you wake up in the morning and have some crustiness on your eyelashes, and your eyelids are a little bit swollen. Your vision is very foggy in the morning, and you don't know what's going on. You come into the office, and we call it blepharitis. So blepharitis, we can help get under control with proper lid hygiene, but there's a condition called demodex blepharitis that's a mite. And Dr. Schramm is also an expert in this. Dr. Expand.
I might have some information about that.
Do your 1 minute spiel on demodex and how we can get it under control. I mean, we use something called Optase eyelid wipes, Optase eyelid cleansing wipes that has tea tree oil in it,
Mhm.
and oftentimes it helps get this under control.
Yeah, well, for years we didn't really know much about demodex mites along the eyelashes, and I remember about 10 years ago, I had a patient who had blepharitis, chronic blepharitis, was seen by multiple eye doctors, both ophthalmologists and optometrists, and they all had prescribed the same thing that I would have prescribed. So I was like, this just doesn't make sense. He's got itchy eyes at nighttime. He's got all this irritation along his eyelids. I went to at the time I was living in Fort Lauderdale. I went to my alma mater, Nova Southeastern, the medical library, and I found an article by Schaefer Sang, and he's like, this stuff called these mites live along the eyelashes and cause itchy. They come out at night and lay their eggs and cause itchiness. That's when they have their little party. And so I'm like, all right, tea tree oil will kill it. I'm going to go compound some tea tree oil because he said 20% tea tree oil and macadamia oil. Go do that. So about 10 years ago, I started using that on patients, and tea tree oil to the eye is not comfortable. Ouch. You do not do this at home. And it did help, but at the time we didn't have anything to treat it. So I was helping patients with this problem. Then companies got smarter, and we're going to put tea tree oil into lid wipes. So that does a good job of controlling the demodex, the mites living along the eyelashes. But that doesn't completely eradicate them, but it does a good job of controlling them. There are patients that will do fine with just that standalone treatment, but 50% of patients have some sort of sign of demodex living along their eyelids. And one of the biggest complaints is itchiness at nighttime. If these other things that we do fail, as far as like using the lid scrubs with the tea tree oil or Optase with like a foam, we have a newer treatment that just came FDA approved last year, and it's called XDemvy. And XDemvy is really easy to use. It's twice a day. I actually suffer with the same problem, so I'm treated myself as well, and it's really easy to use, twice a day for 6 weeks, and it really eradicates the problem. These mites are a natural part of your flora, but when you have an imbalance of them, it's when they become problematic. And as eye doctors, it's really easy to diagnose. When I first started looking for them, I was pulling out eyelashes and looking under the microscope and freaking out patients because they literally are creepy crawly on the eyelashes. But now all we have to do is just have the patient look down, and there's these little things called collarettes. They kind of resemble rolls of toilet paper along the base of the eyelash, and it's all mite poo that's on the eyelash, and that's when they come out and lay their eggs at nighttime. So the XDemvy eradicates these mites, and it's specific to killing mites. It doesn't have any negative effect on the eyes.
What's the application for that new drug?
Literally, it's just an eye drop, and twice a day for 6 weeks. They don't have to do any in the studies. They didn't have to do any particular lid hygiene. I still do recommend patients clean their lids because that's going to help prevent them from coming back even longer. But it has a good utility in that they stay gone for a while after the treatment too.
Awesome.
Mm-hmm.
So I recommend trying the Optase eyelid cleansing wipes first. And you can check that out at fortify.com, FORTIFEYE, fortify.com. Go to eye care, and those Optase eyelid cleansing wipes are there. And that's good for regular blepharitis as well as for demodex blepharitis. All right, we're getting ready to go to the phones. We're going to talk about myopia control in a minute and a little bit more about meibomian gland dysfunction. But give us a call at 1-877-969-8600. Let's go to Mary in Gainesville. Mary, thanks for holding. Good morning.
Good morning. I have two questions. About 10, 15 years ago, I had a torn retina. And the retinal doctor, the specialist, used on me something called a bubble, which was new at the time, and it worked for me. But the reason I'm calling is I believe that there are scars left in the eye. Do you do anything or not, since it was so long ago?
Right. So oftentimes with the retinal tear, retinal detachment, they'll put a bubble in there depending on the location, or an oil, or they'll do different types of surgery, lasers, cryotherapy. And this will leave scar tissue. Okay. And so we can see that scar tissue with our indirect ophthalmoscope or with our optomap. looks at the peripheral retina. And if that scar tissue is in the periphery where it usually is, there's nothing to be concerned about. All right. That scar tissue is good because that keeps the retina from detaching. Now, if that scar tissue is in the dead center of your macula, you're going to have significant vision loss. And at this point, there's not a lot that can be done. A competent retinal surgeon can remove certain types of scar tissue in the macula, epiretinal membranes and things like that. But usually scars that are related to retinal surgical procedures in the periphery, those you're going to go to the grave with, but they're really nothing to be concerned about at this point, really.
Okay, great. The other question has to do with, I think I have listened to at least 2 or 3 podcasts about really, I believe, cardiovascular health, because I listen to a lot of podcasts.
Right.
But one of these studies, or at least 3 people mentioned that they were trying to figure out the role of fat for cholesterol and all of that in some of these studies. And the way that they checked how these fat influence the body was by looking at the eye and seeing how almost pretty quickly after you ingest these fats, well, I'm saying that was my interpretation. I may be wrong about how he interpreted, but anyway, but apparently the fat it ended up in the veins of the eye.
Right.
And so the question that I have is that the case? Because this had to do with cardiovascular health.
Right. So
I'm wondering how that affects the eyes and if it could maybe be used to heal some other illnesses having to do with the eye.
Great question. Great comment. All fat is not bad. All right. And that's why I recommend all trans fat is bad. So if it says trans fat, never consume it. But like if you have a grass-fed steak, that's got a lot of fat, but it has high omega-3 content. The fat in most of the beef that you're eating is fed genetically modified grains that are very high in pro-inflammatory omega-6 fats, and that creates a lot of problems. So the eye, remember, is the window to the body. And seeing a competent optometrist, optometric physician, ophthalmologist that really knows what they're doing and using some new generation technology like the OptoMap that has autofluorescence, we can actually look at significant magnification at the vascular system in the eye. We can even go under the retina in the chorial capillaries, and we're looking at tiny, tiny little blood vessels, okay? And we can see if there's any blockage and leakage. Plaque will build up in the eye. And so oftentimes on a daily basis, we see patients that plaque is building up in some of these tiny little blood vessels, and we make an appropriate referral maybe to their cardiologist or their internal medicine doctor, and this can help save their life, literally, prevent them from having a stroke, prevent them from having a heart attack. So I tell people, if for any reason, especially after the age of 60, a routine eye exam annually and seeing somebody that obviously either dilates your eyes or even better yet, has OptoMap technology or something similar to the OptoMap, it's a really good form of preventative medicine because yes, indeed, we can see if the fat that you're consuming in your diet is causing a potential problem. And only the eye doctor can do this. You think about it. You see the cardiologist, they have to do it invasively. They have to inject the dye and you go into a cath lab where they do something like that. But the eye doctor can look at the vascular system. And remember, it's a direct reflection of your cardiac and your brain health, the window, the vascular system in your eye. So that's a great question.
Yeah, the eye is the only part of the body you can look at the blood vessels while they're in action. We have a view of them without having to cut into you.
Right. So the gist of this story is, Mary, if you haven't seen your eye doctor lately, get in and call around and see if somebody has an OptoMap. It makes it much easier. And then they can show you on the OptoMap exactly what's going on if you have any occlusions, any plaque, anything negative. Okay. And also, it's the best way to look for small retinal holes and retinal tears that they might miss with their indirect ophthalmoscope. Okay.
Okay. And it's called what? To ask?
OptoMap. OptoMap. A lot of doctors in the Gainesville area have that technology, and I love that technology. I mean, I can't practice without it these days.
Okay, awesome. Thank you so much. I appreciate it.
All right. So, Dr. Schramm, the music is on. That means we only get 57 seconds. I wanted to mention that the Lange Eye Institute is now involved in myopia control for children. Dr. Schramm is an expert on that. Dr. Schramm, do you have any social media people can follow you on or email or anything?
Dr. Nathan Schramm, Instagram. Yes.
Right. Dr. Nathan Schramm, Instagram. And of course, you guys can watch us on Instagram, watch this show on YouTube, LinkedIn, Facebook. And our Instagram site is Dr. Michael Lange _ Dr. Michael Lange _. Of course, you can email me at idude92@icloud.com. Thanks for being a guest, Dr. Schramm.
Yeah, thanks for having me, Dr. Lange.
All right, we're out of here. God bless you and God bless America. See you next week.